Chapter 12 Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 1. Listen to dialogue number 1. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Hello, my name is Frank Walker, and I'm the clinic pharmacist for today. Are you Emily Lynch?
Yeah.
How are you today?
Well, I could be doing better. I guess you know why I'm here. Dr. Alexander said you would talk to me about my medication for my vaginal yeast infection.
That's right. Dr. Alexander prescribed a non-prescription medication called Monistat. You can buy it over the counter in any pharmacy or supermarket. I'm going to give you a sample to take home with you, but you'll need to go to your local pharmacy to buy some more. Do you know what Monistat is?
Well, I've seen commercials for it on TV. I've never had this problem before, yeast infection. This is so embarrassing.
Well, it's quite common. In fact, 3 out of 4 women will experience vaginal yeast infection, and there's no reason to be embarrassed. Dr. Alexander wants you to take Monistat 7 suppositories.
I don't take a pill?
No. You will insert a suppository using the applicator into your vagina as if you were inserting a tampon. It's a 100 milligram suppository.
How often do I insert it?
You need to insert a suppository using the applicator once nightly for 7 nights. This medication will help you to treat your yeast infection.
Is the medicine going to hurt?
No, the medicine should not hurt you, but you might feel some irritation or burning after inserting the suppository. These are only potential side effects, and I would recommend wearing a light panty liner as discharge from the suppositories can occur.
Is it going to get rid of the itch and the thick discharge that looks like cottage cheese?
Yes, it should. These are typical symptoms of a vaginal yeast infection.
I've never had a yeast infection. Is this considered a sexually transmitted disease?
No, it's not a sexually transmitted disease. You can relax.
Then how did I get it?
Well, certain changes in your environment can trigger an overgrowth of a naturally occurring fungus called Candida.
Fungus?
Relax. A lot of factors can trigger a yeast infection, like certain antibiotics, pregnancy, birth control pills, and menopause.
Well, I'm not pregnant or menopausal. I'm only 21, but I am on birth control pills. But I've been on the pill for 3 years, and I've never had a yeast infection.
Sometimes bubble baths, vaginal contraceptives, and tight clothes can trigger the growth of the fungus.
Really? Bubble bath? I got a new bottle of bubble bath recently. Maybe that's how I got it.
It could be. The good news is that you saw your doctor soon, and now you can start treating it.
Okay. Thanks for the info. Now I know to stay away from bubble bath. If I stop using the bubble bath, I'll be okay and not get another yeast infection?
Well, it's a good idea to stop using the bubble bath, and there are other things that women in general should do to prevent vaginitis and yeast infections. Try to avoid whirlpools and hot tubs. It's a good idea to avoid scented pads and tampons. They can irritate the vagina.
Can I still douche? I douche once in a while.
I wouldn't douche. Douching can actually cause vaginal infections. It certainly doesn't clear up infections.
Really? I didn't know that. I'll have to tell all my girlfriends.
I would recommend eating yogurt that contains active lactobacillus cultures. Lactobacillus is a good bacteria that is common in the vagina.
Are you serious? I had no idea. Wow, I've really learned a lot. Dr. Alexander didn't tell me any of this. He just said, take Monistat.
Well, I'm glad you've learned a lot. And don't forget to take the entire dosage. Finish the entire course of treatment, even if you start to feel better.
You mean finish all 7 suppositories?
That's right.
Will do. Thanks a lot.
Chapter 12 Pharmacist-patient dialogues. Listening and comprehension exercises. Dialogue number 2. Listen to dialogue number 2. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple choice questions at the end of the dialogue.
Good morning. How are you today?
Okay. I need a prescription filled.
Sure. What's the prescription for?
I have ED. You know.
Sure. I understand.
Here it is. I've been here before.
Okay. Let me look you up in our computer. What is your name?
Lester Greenwald II.
Lester Greenwald II. Is your date of birth July 16th, 1951?
Yes. All the information is the same. Same address, same insurance.
22 Ardmore Road in Westmont? And you have healthy life insurance?
Yeah.
I want you to know that your insurance plan does not cover Viagra.
Are you serious? You gotta be kidding me. This is ridiculous. I pay part of the cost of my insurance. Those lousy insurance companies get you all the time.
Mr. Greenwald, I can understand your frustration. I would suggest calling your insurance company.
Oh, you bet I will. I'm sorry. You can call me Les.
That's okay, Les. Like I said, your prescription is for Viagra. Did Dr. Ahmet talk to you about Viagra?
Well, he told me it will probably take a while before I improve. You know, I was having a lot of pressure and stress at work, and I was depressed. I was taking Zoloft for a while. The doctor told me that's what's causing my ED. Psychological. I'm not physically abnormal, you know.
Are you still taking Zoloft?
No, I started to feel better, so I don't take it anymore. But I think maybe the Zoloft could be the reason why I've been having this ED problem. It's never been a problem in the past. I've had ED for more than 2 months. That's when I went to see Dr. Ahmet, our family doctor. My wife has been patient and understanding, but, well, you know.
I understand. There are several reasons for erectile dysfunction, or, as you say, ED. Your doctor is prescribing Viagra because he feels it will treat your situation. You're not alone. Many men experience ED, and you're lucky you have a patient and understanding wife. Would you like to know how Viagra works?
Well, I guess.
Viagra will help to relax the smooth muscles in your penis. What this will do is increase the amount of blood in the penis to cause an erection during sexual stimulation. Viagra will help an erection to occur.
Is it a pill or a liquid?
It's a blue diamond-shaped tablet. Your doctor has ordered 50 milligram tablets. You take 1 tablet only before sexual activity.
How soon before my wife and I can get intimate? You know.
Well, you can take it between 4 hours and 30 minutes before, but taking 1 tablet about an hour before sexual intimacy is most effective. And it's very important to remember that Viagra can be taken only once in a 24-hour period.
How soon will the Viagra start working? And how long will it last?
Well, the Viagra should start to work 30 minutes after taking it. The medication should last for 4 hours, but after 2 hours, it works less effectively.
How about side effects? Is there anything I should worry about?
Well, there are some common side effects to look out for. You can become dizzy, flushed, get back pain, diarrhea. Viagra is also known to cause blue vision, which is sensitivity to light. I'll give you a complete patient leaflet for you to read very carefully.
Do I eat when I take the tablet?
No, you don't have to. But if you do, don't eat a high-fat meal. A high-fat meal may delay the onset of Viagra.
Well, Dr. Ahmet thinks Viagra will help me. I'm not taking any medications right now that would be a problem. I don't have any medical problems except this problem.
That's good to know. You should also know that men on Viagra should not take heart medications that contain nitrates. Do you have any other questions?
Yeah. When will this problem go away?
Well, you're not going to see changes immediately. Every patient is different. If you see that your situation is not improving, please see your doctor again. he may need to adjust the dosage.
Okay. Thanks so much.
Chapter 12. Post-Assessment. Dialogue number 1.
Good morning.
Good morning.
I'm the clinic pharmacist, Rosa Mendez. Do you need help?
Yeah, I gotta get a medication. I have the clap. Doctor said I have gonorrhea.
What is your name?
David Cunningham.
Did your doctor give you a prescription?
Yeah, it's right here.
Your doctor, Dr. Sanderson, has prescribed 2 antibiotics, doxycycline and azithromycin.
He did? 2? Why 2?
Doxycycline is used to treat gonorrhea, and azithromycin is used to treat chlamydia.
Chlamydia? I have gonorrhea and chlamydia?
According to your doctor, yes. Let me explain to you how both antibiotics work.
As long as it stops this burning sensation when I piss. Urinate. And I also have some kind of discharge coming from my penis. My doctor told me my urethra is infected.
Gonorrhea and chlamydia are both bacterial infections spread through sexual contact. The antibiotics will help to treat the infection.
How long will I have to take both antibiotics?
You're going to take both antibiotics for 7 days. You're going to take the light yellow doxycycline tablet, which is 100 milligrams, twice a day for 7 days. Take 1 tablet in the morning and 1 tablet in the evening, and you're also going to take the red azithromycin capsule once a day for 7 days.
Can I take them together?
Yes, but don't eat food with them. Doxycycline should not be taken with food, and you don't need to eat food with azithromycin. Take both medications at least 1 hour before or 2 hours after meals.
Okay. That's it, huh?
Well, you need to be aware of possible side effects.
Like what?
Well, with doxycycline, you could experience nausea, upset stomach, dizziness, trouble sleeping, and lightheadedness. And try to avoid sun exposure as it may cause photosensitivity. And with azithromycin, you could experience diarrhea, loose stools, vomiting, and abdominal pain. I'll give you a complete computer printout of the side effects for you to take with you and read carefully.
Sure. Is that it?
It's really important that you finish the entire prescription. If you stop taking your medication too early, the infection could return.
Oh, I'll finish it. I don't want this stuff to return. It's no way to live. I guess sex is out of the question.
Avoid sexual intercourse until after your infections are completely gone. See your doctor after you finish the prescribed antibiotics, and use latex condoms when you're ready to resume sexual intercourse and avoid oral intercourse. Gonorrhea and chlamydia are contagious. You can get both infections again if you don't take measures to prevent getting and spreading both. And it's critical to let your partner
or partners know. I know. I hear you. I just hope these antibiotics do the trick.
It's important to practice safe sex. If you have any concerns, please call your doctor or call the clinic pharmacy. The phone number is on the medication bottle label. Now, David, I need to confirm some information that appears in your chart.
Sure.
Your date of birth?
May 18th, 1983. I'm 24.
Address?
643 Millbrook Road, apartment 4C in Morton.
Phone?
543-0090.
According to your doctor and your patient records in your chart, you have no allergies and you're not taking any medications?
That's right.
And do you have insurance?
No, I'll be paying cash.
Chapter 12. Post-Assessment. Dialogue number 2.
Hi, are you the pharmacist?
Yes, I am. I'm Stuart Robertson. How can I help you?
I have a prescription for 2 medicines I can't pronounce.
Do you have the prescription with you?
Yeah, here it is.
Okay. Your doctor, Dr. Gerber, has prescribed levofloxacin and metronidazole. Do you know why she has prescribed these medications?
Yeah, I have PID, short for pelvic inflammatory disease.
Okay. What is your name?
Roberta Livingston?
Okay, Roberta. Have you been to this pharmacy before?
No.
What's your date of birth?
June 19th, 1985. I'm 22.
Home address?
65 Springdale Road in Cherryville?
How do you spell Springdale?
Springdale.
Your doctor is Dr. Francesca Gerber?
Yes.
Roberta, do you have any allergies?
Just iodine. I can't have cat scan dye or shellfish.
Are you currently on any medications?
No, I just take Tylenol when I have a headache. I take vitamins too.
Are you on birth control?
Not now. I had an IUD, but my doctor removed it. And now that I have PID.
Have you taken levofloxacin or metronidazole before?
No. How often should I take them?
Your doctor has prescribed that you take the levofloxacin once a day. It's a terracotta pink 250 milligram tablet. You need to take the metronidazole twice daily. It's a white, round 250 milligram tablet. You can take them together. You can take one levofloxacin and one metronidazole in the morning and one metronidazole in the evening. They will stop the growth of the bacteria that is causing your PID.
Can I take them with food?
You need to take both of them with a glass of water or with milk to prevent an upset stomach. Both medications can cause an upset stomach.
How long do I take both medications?
Your doctor has prescribed they be taken for 14 days.
Besides maybe an upset stomach, are there any other side effects? Can I still drink alcohol?
No, you can't drink alcohol when you take metronidazole. And you should also know that because you take vitamins, you need to take the levofloxacin either 2 hours before or 2 hours after you take your vitamins. Vitamins and antacids bind with the other medication to prevent the medication from being fully absorbed. Now, as for the other side effects, both can cause an upset stomach, diarrhea, drowsiness, nausea, headache, and loss of appetite. In addition, metronidazole can cause constipation and dry mouth, and levofloxacin can cause trouble sleeping.
Okay. You mentioned that they help stop the bacteria in my body. Is it going to stop the pain in my pelvis and my lower abdomen and in my back and the heavy vaginal discharge I have?
Those aren't typical symptoms of PID. The medications will help, but it's important to take the fully prescribed dosage. Don't stop taking the tablets, even if you start feeling better. PID is a serious disease that needs to be treated. It can lead to complications such as chronic pelvic pain, ectopic pregnancy, and infertility. I'm sure your doctor has discussed this with you.
She has.
And of course, it's important to tell one's partner and to abstain from sexual intercourse until the infection has cleared up, and to
practice safe sex and to use a condom.
Good. If you have any problems with the medications, call Dr. Gerber or call us. Roberta, do you have any other questions?
Can I use my credit card to pay for these? I don't have insurance.
Sure.
AVN Pharma Education.